My name is Michael Ann Baker, and I'm a psychologist by training. And my role here as the coordinator of clinical training at UCSF Alliance Health Project. So we are a community mental health agency that's publicly funded through DPH, the city DPH contracts. We primarily serve the LGBTQ plus communities as well as people with HIV. We've been around for about 35 years now, and we originally started as the AIDS Health Project, and then in 2012 changed our name to Alliance Health Project to reflect our broader mission of serving the whole LGBTQ plus community. So our mission is to support the mental health and wellness of the lesbian, gay, bisexual, transgender, queer, and HIV affected communities in constructing healthy and meaningful lives. Most trainees carry a caseload of anywhere from 8 to 10 clients, mainly seeing individual clients, but also many trainees get matched to co-facilitate a group with a staff member. Some trainees also do our clinical intakes where they open up clients new to our system and do a biopsychosocial assessment that results in a diagnosis, and then refers them to our array of services. They're also responsible for, doing charting, doing consultation with other people at the clinic who might be working with the client or people in the community. And those are the main responsibilities besides the training and supervision also. So most of our clients are either self-referred or referred by a primary care physician or other people in the community who know about our services. Many of our clients come back or self-referred because they've been here before, and they call up our triage system. And we have a staff who do the triage to make sure the client's still eligible for services. And then they're assigned to have an intake. Most of those intakes are done by staff, but some of the trainees do some of the intakes also. Once an intake's been completed and we have a good sense of the client's overall picture and what they're looking for and what services we have to offer, they're generally put on a wait list, and then they're matched by myself to either a staff person or a trainee based on the clinical needs. And so that gives you a little idea of how people come in and how they get situated with a provider. Yeah, so I was talking a little earlier about the caseload. So it's generally about 8 to 10 hours that people do of clinical work a week. And that's a mixture of doing individual therapy. We do 20 session model weekly therapy. And then we do an every other week model where the trainee sees somebody at the beginning of the year, and then they end with them at the end of the year. So it tends to be about 20 sessions, but over the whole 11-month period. Some trainees also do co-facilitate groups and do intake assessments. And then one thing I didn't mention is some of our folks, trainees who are versed in gender health or are interested in learning more about gender health, can participate in providing pre-surgical assessments for our trans and non-binary clients who are seeking gender affirming therapies. So many of our staff are gender team members and are very knowledgeable about how to do that in a very client-centered, gender-affirming way. Well, we offer two things: group supervision, 2 hours of that, in groups of 8 people or less. And I do that group supervision. And then we offer individual supervision 1 hour a week. And all our supervisors are licensed clinicians who work generally either 32 hours or 40 hours a week. So they are available not only for that hour, but throughout the week. And then one other thing that's not supervision, but We have a really great system of crisis management here, so that if your supervisor is not available, there is always a clinical staff who's available to assist the trainee. And so that's a very robust thing, and they can help with the client, help with the trainee um, outside of what would be the normal hour of supervision. Our didactics are on Thursdays from 9 to about 11:45. There's an hour and a half training and then a break and then another hour training. And it's for a whole range of different topics. So we do mainly integrated mental health substance use work. So many of the trainees will have clients who have co-occurring issues. Um, and so we do have a broad focus on mental health issues and theories of mental health that are helpful. Things like we do time limited dynamic psychotherapy. So we teach people how to do relational therapy, but we also integrate trauma treatment, as well as substance use principles like harm reduction, stages of change. And we do all that while also including how to be culturally responsive. So we have teach cultural humility principles and anti-racist stance, so that all those are integrated into the way you might approach or have a stance with your client. And then, of course, since we work with sexual and gender minorities, there's topics around LGBT mental health disparities, things about working with people with HIV, different ethnic and racial groups, issues related to that and how to serve them best, as well as more general principles around cultural humility and anti-racism. Those are all a part of our didactic schedule. I think students who are most successful here have a strong passion for our mission of serving LGBTQ plus people, as well as people with HIV. It doesn't hurt to be organized, because it can be kind of a demanding setting, because we do Medi-Cal charting and billing. Definitely having self-awareness and a self-reflective capacity is really helpful, since this work can bring up a lot of things for people. And I think that's a really good skill that we teach, how to work with one's reactions and countertransference. So having some self-awareness is good. Being committed to cultural responsiveness, both in the sense of cultural humility and having an anti-racist awareness in the work, is really important. And being somebody who generally is cooperative and likes to work on teams, since we all work as a team in the agency, and consultation is a really valued aspect of the work we do with each other, which is great because you're never alone in the work. You'll always have people who are there to support and help you think through a case, and are often working simultaneously with the client. I think I gave a little hint of that when I talked about doing Medi-Cal charting and billing. So we are a public health clinic, and what's great about that is we can serve people that normally aren't served by private insurance. But many of our people come who are impacted by multiple problems. And so it can be challenging that way. But there's, like I said, a lot of support for dealing with that. And we work as a team. And then the Medi-Cal charting and billing is just like a necessary beast you have to learn. And it's also a very marketable skill. And we give you a lot of support around that with documentation manuals, and walking you through how to do that on the various electronic health records, as well as helping you in individual supervision to really learn that important charting system. Yeah, one thing that we are able to do is we're able to offer our students at least right now, a $2,500 stipend each year. And we're hoping to potentially increase that next year. But I know for a fact the minimum of 2,500 will exist next year. And if we get some grants that we've applied for, we might be able to add to that. And then also being part of the Department of Public Health, students can apply for the multicultural student stipend. And that can be anywhere from $1,500 to $2,500 also to help you with your process of getting your education and training.